I witnessed my grandmother become blind. I witnessed my grandmother lose a toe. I don't want to see that happen to myself or happen to my granddaughter. For the first few years, I was in denial, so I wasn't testing, wasn't taking the medications properly. It took me 2009. I then had Bell's palsy and a heart attack.
I was told by my medical doctor that I had high blood sugar levels, that actually I should have been hospitalized because they were extremely high.
The Win to Lose program was a program that the Detroit Medical Center offered as an incentive to help people lose weight. I started walking more with that program. I started watching what I was eating with that program. I started then relentlessly checking my sugars, taking my medications, doing exercises. I ended up losing 100 pounds, which helped me get my diabetes under control. I love this machine. I hope that it becomes a permanent part of my life. Hopefully it is something that I can get into the life of my granddaughter also. I think that it would really benefit her and her parents, so that when they're taking her to her appointments, the doctor can really have a understanding of what her readings are and base her medications on that, so that we can defeat this.
Yes, we're very interested in improving the health of our employee base. We have 14,000 employees working through the Detroit Medical Center system, and we know that perhaps as much as 10% of them have diabetes that's being managed right now. We're excited we'll be able to enroll about 20 of them into this new pilot program on wireless blood sugar monitoring information systems, and we hope to see that their health is improved, and perhaps we can prove that it should be expanded throughout.
I came upon the Telecare at the beginning of this year. This device allows the actual physicians and triage nurses get the actual reading instead of what a person is telling them. It tells you the average readings over the past 7 days, over the past 30 days. So it's really good for those people that don't record manually. And I love that it transmits those readings over electronically.
That they right then would have the history and could monitor it daily and for whenever I took it. So when I came into the office, they would already have all those readings, and they would already know if I needed to come in sooner, or if I was doing good or not so good.
Julia, are you eating something you're not supposed to be? Your blood sugar's 180.
I'm sorry.
All right, well try to eat something healthy like some carrots or something, all right?
I know. Okay, talk to you later.
If we can prove that the patient is checking their blood sugar regularly, then we know that we have a better chance of impacting their long-term compliance. So the more we can teach and engage the patient in their own disease management, the better off they'll be long-term.
Real-time reporting is important because you're able to get to the patient quicker, so you can make adjustments to their care plan, adjustments to their medications, so that there's less damage to them, they're less sick and less likely to end up in the hospital.
We get to know the patients. When we call, we introduce ourselves. We say that we are, for example, my name's Jackie, I'm a DMC Care triage nurse, and I'm calling you because of your blood sugar is elevated, or your meters are not reading correctly. And I'm going to let them know, the caller, the patient know rather, that we're going to be calling daily because we care and we want to help you manage your health care.
Diabetes is a very expensive disease. So this is a great plan because we can follow it, and we can make sure that patients do follow their care plans and are able to stay out of the hospital, out of doctor's offices frequently, and then they have a better quality of life. So that also is less costly to the healthcare system.
My grandmother's from Mississippi, so they didn't call it diabetes. They said the sugars. And so as a child, you're like, goodness, the sugar is doing that to you. So at that time, I kind of strayed away from sugar. I'm like, okay, if sugar's doing that to you, I don't want it.